Hello, everyone, and welcome to your favorite health and wellness podcast, Own Your Health. And of course, I'm your host, Opoluwa, and today I'm going to be talking on the second part of risk factors for developing high blood pressure. How has your day been so far? I trust all has been well. So it's important that we understand these risk factors so that we can prevent ourselves from developing it, or we can actually help to reverse high blood pressure. Yes, you heard me right. It is possible to reverse high blood pressure because I know a couple of people that have done that. So how and what are these risk factors? Let's talk about unhealthy diets. Diets that are high in sugar, refined carbohydrates, salt, bad fats like trans fats, diets that are low in nutrients but are high in calories can lead to weight gain, which then increases the risk of developing high blood pressure. Also, processed foods usually contain a high level of sodium, high levels of unhealthy fats, and even added sugars that can actually raise blood pressure. Examples are canned soups, canned foods, snacks, fast foods, even deli, which can be high in salt. We also have prepackaged ones that are serious culprits. There's a nugget that states, don't dig your grave with your fork. So let's look at another risk factor, which is smoking or tobacco use. Some people smoke tobacco while some people chew it. Now, this can actually raise blood pressure temporarily. How? The main active ingredient in the cigarette smoke is nicotine, which stimulates the release of two important hormones called epinephrine and norepinephrine, which actually tighten the blood vessels, called vasoconstriction, and that increases or raises blood pressure. Let's look at the third one, high caffeine intake. Caffeine actually affects individuals differently, but an excessive amount or consumption of caffeine can indeed raise or spike blood pressure levels also temporarily. Let's look at number 4, hereditary factors. Genetics can play a significant role when it comes to chronic disease like high blood pressure. I would like to add that it's how the genes express themselves under different circumstances that really matters. That is epigenetics. We are not doomed by our genes. It is the environment around our genes that really determines how the genes are expressed at different times. Epi means above. So let me share this quote that says, genetics load the gun, but it is our lifestyle that pulls the trigger. So we are not doomed by our genes. We are not destined by our genetic code. It is the environment we place around our genes, which include our diet, our drinks, our thoughts, our environment, that actually determine how these genes manifest. We can actually put those genes to sleep, or we can wake them up. That is why such changes can actually prevent or reverse chronic diseases. Let's look at the fifth one, sex. Gender also plays a role in raising blood pressure. Men are more likely to develop it more before the age of 55, while women's risk increases at a higher age, even after menopause. This has to do with hormones. Let's look at medications. Medications have the good what they do. They're good for the different things we take them for, but they actually have some unpleasant side effects. Almost every medication has the unpleasant side effects. Certain medications and supplements can actually raise blood pressure, and such medicines include a group of drugs called the antidepressants like SSRIs. Examples are paroxetine and fluoxetine. They raise blood pressure. Birth control pills can raise blood pressure because of the estrogen in them. Some anti-inflammatory medications that we take like ibuprofen, diclofenac, naproxen, they can actually raise blood pressure. And certain supplements that we take can actually raise blood pressure. And examples are licorice. Licorice, when consumed in a large amount, can actually raise blood pressure. Let's look at another risk factor, sleep disorders. We all need adequate sleep at night. Inadequate sleep, such as getting less than 6 hours of sleep, can actually raise blood pressure. As for me, when I don't get enough sleep, I tend to get headaches. So I can just assume that it's raised my blood pressure a bit for me to be getting those headaches. Other sleep disorders can also raise blood pressure, and these include people that suffer from insomnia on a permanent basis and sleep apnea. Let's look at hormonal changes. This is a risk effect that tends to affect a lot of women. Mostly it affects men too. Research has discovered that a hormonal imbalance that makes it difficult to control blood pressure in about 10% of hypertensive people has been discovered. Hormonal changes that occur during pregnancy and even during menopause in the lives of women can affect blood pressure. Examples are pregnancy-induced hypertension, and this can be deadly if it's not well monitored and treated, because the woman can end up going into rigor, having seizures, which may eventually lead to death, and can even lead to the death of the baby. I do hope these few risk factors that I've shared in this part 2 are useful, are helpful, and they're practicable for you. There's actually simple things that we can apply in our everyday life. And so if you have found this podcast useful, please like and share to other people. You might be saving somebody's life. And until I see you next episode, do have an amazing day. Catch you later. Bye.